Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Everyone, and welcome to the MMOA, the Older Adult Podcast, brought to you by the Institute of Clinical Excellence. My name is Csepe. I'm a doctor of physical therapy coming to you from Littleton, Colorado. Thank you so much for joining me today. On our agenda, we are going to talk about the obesity paradox. For my entire professional career, and before that as a personal trainer and group exercise instructor, I have wondered why I've been deeply passionate about treating those with obesity and also addressing it in my clinical practice as an outpatient physical therapist. I've recently started to work more with the many doctors who are prescribing new weight loss tools to their patients, specifically GLP-1 medications like Ozempic, Wegovy, etc., with the understanding that it is so important in our profession to be advocates for the appropriate use of these medications in mainly preserving muscle mass. So we're seeing the medical treatment of obesity medicine hugely expand. And we have a job to make sure that we're keeping our patients strong throughout this treatment. And that's what we're talking about today. We're going to talk about not just understanding obesity a little bit more in our job to treat. We're going to also talk about the obesity paradox, which is a really common theme in obesity medicine that often gets misunderstood, and what we need to know about the obesity paradox while we're treating our patients. So first and foremost, what is the obesity paradox? I took a course which was really impactful for me in my practice called Obesity Fundamentals from the Obesity Medicine Association. It's actually not even directed towards physical therapists because as a profession, unfortunately, we have taken so little liberty and any responsibility in treating this very prevalent medical condition. But the Obesity Medicine Association developed a fundamentals course for providers to really understand the fundamentals of obesity treatment, including medical management and some paradoxical information about obesity. And the obesity paradox is basically a paradoxical fact that sometimes obesity can be protective for our health. So there are many obesity paradoxes that are cited in the literature. And it's our job to kind of understand those things and how they can impact our patients. So with the obesity paradox is basically certain conditions are better protected when you go into them with obesity. Those things like osteoporosis, those with osteoporosis, or you are less likely to have osteoporosis if you have obesity. Managing kidney disease and severe chronic illness, even some heart diseases, there are better outcomes if that person also has obesity, which seems really paradoxical. And my job today in explaining this obesity paradox is a bit of explaining how that might come to pass. So understanding that those with critical illnesses, kidney disease, even cancers, cardiovascular diseases are better if they have obesity. Their outcomes are better is largely dependent on the knowledge of a few different things. Number one, those who are smokers are less likely to have obesity. And when you are a smoker and your weight is lower, that skews that information and that data to be in favor of those who are not smokers. So understanding that being a smoker and having other health outcomes can negatively impact your outcomes with those critical illnesses compared to not being a smoker and also having obesity. So that's an important thing to understand. Also understanding that overall nutritional capacity and having excess adipose tissue, which provides excess nutritional stores, is helpful when you face something stressful. So when you're in hospital or you have cancer, and you're in a state that your body is in stress, understanding that obesity can be protective because you have excess nutritional stores to draw from, helps to also explain this obesity paradox. Interestingly enough, people who go through severe trauma, car accidents, are less likely to have, or even physical trauma like a laceration, stab wounds. The obesity and adipose tissue can be protective to our bodies. So there are many conditions that, or situations in which obesity is protective. But here's the big tipping point. Overall, people that have obesity and overweight, their overall mortality and morbidity is lower. If you even it all out, is having excess adipose tissue protective throughout older age? No. The important component here is the amount of muscle mass that you have, which brings me to my next point. So if we're going to understand that having obesity can be somehow paradoxically protective in different health states, but isn't overall better for us than having normal weight, how do we integrate this and understand it with our patients? The more that we look through the lens of treating obesity and excess adipose tissue as a disease process, we understand that there's a big difference between the weight associated with muscle mass and the weight associated with fat mass. And understanding that is key to helping our patients, because a lot of clinicians have a bias against treating obesity like a disease that requires medicine. And a lot of physical therapists too, myself included at one point, feel some apprehension knowing that their senior patients are potentially losing vital muscle mass while using these medicines, because it's guaranteed. If you're going to lose weight on these drugs in treatment of your obesity, you are likely going to lose muscle mass. That matters more for the patients that we care about most, those who are seniors, because we don't want them to lose that critical muscle mass. But it's important for us to know, because often people will use this obesity paradox as a reason to avoid prescription of GLP-1 medications or even discuss weight loss with their patients, because, having excess weight can be helpful when facing these conditions, but it doesn't negate the potential benefits of having a healthy weight and having healthy body composition. That's kind of my take home message for this, that it doesn't outweigh the potential benefit of not just having a healthy body composition, but also having a healthy activity and diet. So you can have obesity and still be active and still have healthy nutritional intake and be better off than without those two factors improved. So that's a big take home message here. A lot of other people will use this obesity paradox and say, well, I can be metabolically healthy, but have obesity. An important stat that I'd like to look at from this course that I took is that, that many people there's no standard definition for what it looks like to be metabolically healthy and have obesity simultaneously. There's no standard definition, but it basically means having obesity according to a BMI that's higher without diabetes, heart disease, etc. So you can have that, but unfortunately, people who are metabolically healthy, or normal weight, metabolically healthy with obesity, with aging, 30 to 40% of those people who are metabolically healthy with obesity, 30 to 40% of them develop obesity within 6 years. So that's an important consideration, that even though you might not have diabetes or heart disease, if that person has obesity, it's not necessarily preventing them from developing metabolic disease later within the near future. So that's an important component too of understanding this obesity paradox, because it is paradoxical that in some situations obesity can be benign or protective to our overall health, but it doesn't having obesity is definitely something that's worth treating. And that's why doctors are treating obesity with medicines. And there's reimbursement for it from insurance because it is worthwhile to treat obesity from a medical standpoint. And it's important for us to recognize as physical therapists our unique role while locking arms with physicians who are treating obesity to say, hey, every physician, by the way, who treats those with obesity tells them you need to be making sure that you're getting enough protein and you need to be exercising so that the weight that you're losing doesn't come from your muscles. Every doctor that I've worked with that has been treating their patients with use of GLP-1 medications is telling their patients that 100%. The unfortunate thing is that they have no way to make sure that the rubber meets the road. Physicians don't have time to say, okay, well, you say that you're consistent with weightlifting. Tell me a little bit more about that. I want to hear how you're doing that. How can I support you as my patient to make sure that that's happening in an appropriate dose, that that's happening with good form, that that's happening with consideration of other conditions that you might have. They don't have the time and the bandwidth to really support their patients in this quest of managing their weight and this health condition with the appropriate interventions. We do. So as we're working around patients, and this is a message that I will repeat until the day that I retire and probably long after that, that it is our job as physical therapists. We as clinicians are educating patients on how to do strength training and maintain their muscle mass, especially if they're taking GLP-1 medications. I recently had a patient who came in, she'd lost 50 pounds using a GLP-1 medication, which was great. Her diabetes was in check. Her health outcomes were much better. But unfortunately, she lost a preponderance of muscle mass to the point that she can now barely walk around a grocery store without using a cart. She also had a concomitant neurological condition. She had Charcot-Marie-Tooth, and that put her at an even worse disposition for losing muscle mass. So it is our job as clinicians and as physical therapists to recognize how important it is to keep muscle on our patients' frames, especially in context of treating obesity. Because yes, we know that in some situations, having excess weight can be protective, but it is worth treating, and having that potential benefit of having excess weight doesn't necessarily mean that you are better off with obesity rather than with a normal weight. That's something that we need to know in regards to your risk factor. Just like people that were smokers somehow had a protective effect against COVID, and people who were smokers were less likely to die with COVID than those who were not. There's interesting literature there, but I'm not telling patients that they should keep smoking if they're smokers because of that paradoxical improvement when facing COVID. Similarly, when I see patients with obesity, I want to be supportive of their weight goals and their medical goals to manage those different components of health, even though there are benefits in certain situations to having excess weight. With all of that said, understanding, how important it is to do our jobs. As you go into the clinic tomorrow, my one little clinical pearl is to recognize how important it is to be in your patient's shoes and to know that they've probably struggled with their weight and felt really guilty about it for a long time. I find the most rewarding thing in my practice while I treat patients with obesity to be recognizing, hey, I know that this has been really hard. This is a lifelong struggle. This is a disease process that you've been facing, and you've probably felt a lot of shame. So the last part of this course about the obesity paradox really recognized that while it's important to recognize that it's still a goal to manage your weight, even though there are some paradoxical benefits to having excess weight, we want to approach that situation without allocating shame to our patients. We want to recognize that saying, hey, well, there are some benefits, but you still need to do X, Y, and Z. We need to really avoid, as providers, this allocation of shame to our patients for a health condition that they've likely struggled to manage their entire lives. So thank you so much for sharing this 10-15 minutes with me. I hope that it could be informative in our role in treating patients with obesity despite this obesity paradox. Thank you. Have a great rest of your evening.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.